name is Dr. Ann Kirsch.
And I'm Dr. Esty Hess. It's such a pleasure.
And our guest today is Seth Kurzban. He is a community mental health social worker at USC. And he is going to talk today about some very interesting things. I will not give it all away. I will let Seth explain to us why he's on our podcast. Take it away.
Thank you for having me. So I actually have to correct, I'm at Cal State Los Angeles now. I left USC.
Thank you.
I was fortunate enough to meet you both. And then when this article came out, which was in last week's Wall Street Journal about the shrinking presence of male therapists, SC invited me to come on and talk a little bit about what I've observed in my own sort of journey in mental health. I'm a social worker by training, and have worked in community mental health for a few decades now. And it's definitely been a change, as I'm sure you both know as well.
Yes.
I don't know if we want to jump right in or if you want to.
Well, I'll tell you what, I'm curious, Seth, and thank you again for coming on, agreeing to be on the podcast. First, your own journey. How did you happen? You said you've been doing it, like I like to say, more decades than I want to admit, right?
Right.
But what drew you into the field to begin with? And let's hear your story, your journey, and then how you would address the fact that there are less and less men going into the mental health clinical practices, and the impact both professionally and then for you personally.
Yes, and I'd add one thing to that, that as a social worker, you know that there are many different things social workers do.
Yes.
Why and how did you end up in community work? Because that got my attention right away, and I think it's amazing and wonderful and needed, especially now.
Yeah. So growing up, I had a cousin who had serious persistent mental illness. He had schizophrenia. And as many people who have severe schizophrenia, he used drugs. He died way too young. And I was very interested in what could be done, what could we do. When I got to college, I went to the University of Pittsburgh, and they had a bachelor's program in social work, and I didn't really know anything about social work. I don't think most people do growing up. It's not a profession. Maybe some people have had contact with social workers, but in general, it's not, one of these glamorous, widely discussed professions. Certainly not when I went to college. So I remember hearing the type of work they did, and I was like, this is fascinating. I mean, being able to have a very applied approach to helping solve community problems. And at the University of Pittsburgh, they have a great psychiatric hospital, the Western Psychiatric Institute and Clinic, where I got to do some work early in my career. And I just loved it. And then went back, got my master's and my PhD eventually, and I've been a social worker ever since.
It grabbed you. That's wonderful. I think
Yeah.
that's what happened.
But I realized I didn't answer your question about community.
Yes.
So because I was interested in this population, one of my first jobs when I still had my bachelor's was working, as I said, at Western Psychiatric Institute, and doing community work, which meant largely following people in the community. They had a satellite clinic in an almost entirely African American community, and I was there, just walking around in the neighborhood, in the community, doing outreach to the clients, and it was for people who had serious persistent mental illness. eventually an evidence-based practice called assertive community treatment came around, but it was sort of that model early on, but it was really based much more with interdisciplinary team helping people in the community. And that was sort of the work I liked because I think for me personally, I wasn't so interested in being a therapist in an office. I was far more interested in how do we help individuals who are dealing with serious persistent mental illness integrate into their social environment. And that's the work that I wanted to do.
So when you mentioned when you first started, I know I would imagine that it wasn't a team, became teamwork. And
Yeah.
so who are the members of your team?
Yeah, so back then I was obviously the most junior person. But there was usually a psychiatrist. There was usually we had psychiatric nurses, and we had some peers who were themselves going through recovery. And it's interesting for this topic, almost all of those were men at the time. Um,
But now,
and
have you seen a change? As you said, we started off making the joke about the decades issue, but over time, and certainly in the most recent observations, what have you seen in terms of uh, are men going into the field? The article says no, but what is your personal observations? And do you have any thoughts as to why that could add to what was already written?
yes, to both those. So, um, there are still some men going in, but largely, like I'll just give you in social work, and I've taught some interdisciplinary classes as well. I mean, it's maybe 10 to 20% are men. I mean, it is skewed far more than the average college classes, towards female students, and other, genders as well. But men are definitely a small minority. And yeah, so going back decades, I mean, I think a lot of mental health and a lot of therapy came from, a psychoanalytic framework. And all those founders of those movements, Jung, Freud, I mean, they were all men. And there was definitely a time period. I mean, you both probably know better than I, but where almost all the therapists were men. It was a very, very male dominated field. Um, I have some thoughts as to why it's changed a little bit different than the Wall Street Journal.
Right.
Um, but I think largely, in a good way, we wanted to have sort of the feminization of both therapy and care, but even in teaching, right? Like teaching used to have, and I'm talking about primary school, middle school, used to also be lots of men, and we see far less men going into teaching as well.
Exactly.
And I think there was this. I'm saying feminization. I don't mean that in a derogatory way. I mean that in a good way. There was an effort to have women be in these spaces, and I think there was some thinking as well that would be a good thing because they have different skills, and these are sort of social emotional environments where it'd be great to have more women. So I think it was a good idea to have more women in therapy and schools and counseling. Um, but I think the sort of side effect of that is men started retreating from those places as the environment shifted a little bit. Um, and I don't know if it was even conscious, a sort of a conscious decision, but it definitely is something, if we just look, has definitely
What do you
occurred.
think? What is your thinking? And you also mentioned that your thoughts were a little bit different than the article. So can you
Yeah.
talk about that?
Well, I don't want to. The article, I encourage people to read, but my take is
Sure.
a little bit more as again because I'm not a private therapist who's office based, and so so for me, just looking more largely at community settings, there's definitely been as I said, just a different approach to try to include more women, which led, I think, to men seeing this as maybe not right. Like, so now when we think of teaching, just, teaching is a more clear example. But when we think of teachers, we think of a woman, and not again, not any sort of judgment attached to that. But it has shifted. Whereas there was a period where if you even look at pop culture and movies from the 50s and 60s, it's always men, male teachers.
Right. Well, listen, when I was, going for my PhD in psychology, the male dominated area of psychology was always forensic and second to industrial, right? But private practice, community work was always, still very much female driven. I'm also
Right.
wondering about the financial piece. If, that as challenging as the clinical aspect is, does it pay the bills, so to speak, in the context of we still, whether we want to go ahead and acknowledge that men and women are paid equally, and certainly I don't think most households today, and certainly in the United States, can manage without a dual income. But does that impact this decision where I want to, put my strengths? Because I will tell you
Yeah.
just separately. I'm sorry, because we also teach at the medical school at UCLA, and there are far less men going into medicine in general for
Yes.
those
Yeah.
for the financial reasons. It's much easier and faster delivery of the dollar to go into tech or banking, for example.
Right. Right. And that's
Right.
profoundly different.
Yeah, and I don't know if it's a chicken egg type situation where we started encouraging more women in these spaces, and then the pay, right? So it was an area where women, I think, could enter more easily than some other jobs. But then, for example, now men see medicine used to be very lucrative, right? Now men see this is this is not as lucrative, and so they're fleeing to something else. So I don't know. I don't know what came first, if the money incentive drew men out, or if it was more as more women entered, the pay became lower or at least capped in medicine and therapy and teaching. Um, it's an interesting thing to think about, though, and we should have more data on what that looked like.
I'm also wondering something else. In the article, they reference that men often do better with their same gendered clinician, certainly in a one-on-one, private practice kind of scenario. And I'm just wondering what, because you're no longer the junior fellow on the ladder there. Um, how would you rewrite the social work curriculum now to encourage young men to come into the field? Because I do think that there is an enormous need, particularly because this is a tech obsessed and somewhat emotionally cut off population that we're all dealing with. I mean, today I heard an article, a very interesting podcast about the fact that you add tech to a classroom and you stop getting learning. And so this is emblematic of, I think, just a tremendous amount of need for emotional context. How
Yeah.
do you go ahead and encourage young men to join the field, overcoming a lot of these obstacles that we're talking about?
And I would
Yeah.
just add one thing to that, without, I hope I'm not overwhelming you, but along with that, your experience, you have a long experience in the field with a group that's all working together, male and female. Are you seeing a difference in who wants to go into that field? Are there more men? Are there more women? I know you probably strive to have it balanced. And also the people that you're working with, are they more comfortable with women? Are they comfortable with men? Is it men comfortable with men and vice versa?
Yeah. So I'm gonna answer Estie's question first, and if I forget yours, Anne, please
That's fine.
remind
Yeah,
me.
I know.
Um, but I would say, I think, going back again into it starts, I think, in elementary education or even nursery. Um, we brought in, again, in a pejorative way, but women are the majority of the teachers in that space. And I'll give you an example. As social workers, a lot of LAUSD and other school systems around the countries want to have way more social workers in their schools. And so one of the things we do is like social emotional learning, and this might touch a little bit on some of both of your work. But I often tell my students they'll talk to me about, doing social emotional learning, and I'll ask them, what about the kid who doesn't want to participate? And a lot of times they'll say, well, they have to. And I think this gets to a big gender difference, right? And I think boys are more likely to not want to participate and act in a way where they're not wanting to sit in the group, they're not wanting to share. And our instant reaction is, well, they have to.
Mm.
But it's sort of ironic because the whole thing we're trying to focus on is that you're comfortable enough sharing your feelings. And I think what happens, so starting at a younger age, is we're increasingly in mental health spaces and educational spaces, giving boys the message that they have to participate in a different way than they want to. And that right then and there changes the trajectory of how they can express themselves. Now, there can be arguments about if that's right or wrong, but a boy who says, I don't want to sit in the circle is still communicating,
Mhm.
right?
Mhm.
But the mental health or the teacher is missing the opportunity to hear that. And instead they're saying, no, no, you have to participate my way. And so I do think there are gendered styles of communication, and they may lessen over time, but certainly in younger years. And I think we are consistently not letting boys express themselves in that way. And I think that spills out later on in life too, as they progress, the message they're getting to be a teacher or to be a therapist is you have to communicate in a certain way. And it's not including people who may be less verbal but more emotive anyway, right? Like it's not only that you have to participate in a very defined way, which goes against the whole idea, of this social emotional and in therapy, looking at nonverbal. But that's the sort of model we've been following for the last few decades for sure. And I think it pushes boys in a tough choice about where they feel comfortable. Because they're consistently getting the message that when they're engaging in some of these spaces, now obviously we're talking in generalities. There are some boys and young men who have no problem with that, but there are some who don't. And we're not making the space for that gendered expression. And I think that filters through the years of both education all the way through professional school, where people feel comfortable. So I think that's part of the struggle.
It's a very powerful observation that you're making.
Yeah.
So, how would you change that to encourage young men to who I think are comfortable with that social emotional intelligence, that awareness, to go into this field because the field needs you. I mean, I will tell you, when I am recruiting interns, I will constantly say, we need more good young men to be these like good daddy figures I mean, I work with an autistic population overall, and for these kiddos that I'm with, so and they feel good about that. They feel very complimented that they can walk in and into this very lovely emotional role for themselves. But I don't know how much that's encouraged overall.
Yeah, and I think it's sort of again a subconscious weeding out that we're saying not directly but indirectly through the language of mental health, through the way we discuss it and talk about it, that we are putting an expectation and sort of boundaries on what that looks like. And that looks like a much more verbal, I'm uncomfortable saying feminine approach, but it's definitely not, it's not even though I think most mental health people would see themselves as very open. There's not a lot of acceptance for people who don't want to talk a lot, right? Like therapy is about talking. Um, how much nonverbal communication, like what are the gender differences around that? What are the hobbies or things men would want to do that maybe they can't do in schools, right? You can't play rough, you can't, right? Again, I'm not saying these are the right things. I'm just saying there is a clear language and culture that gets spread through again education and the mental health and therapeutic worlds, and you have to sort of conform to those expectations. And I'm just saying that it's possible that we are excluding men in particular who maybe don't feel comfortable following that expectation.
It's really very interesting hearing what you're saying. I think for both of us who've been in the field for a long time now, for me, going to schools, seeing young children, watching how the teachers interact, the messages that are sent, verbal and nonverbal, it is striking that after 30, 40 years in the field, the messages are the same. It's the little boy who gets in trouble for talking, and the little girl does not as much.
Right.
Even for teachers who are very aware, and when I speak to them separately about these aspects of teaching, they say all the right things. They know what they need to do, but they come from a time and place where maybe they, were born in the 50s or 60s, and that's how they were acculturated. And so now they see these little kids, and without even knowing it, there is a bias towards how the little girl is treated and how the little boy is treated. Yeah. And I remember that from my childhood. Yeah. Absolutely.
Yeah.
Well, I'm appreciative of your insight, Seth, and it is pushing this discussion into how we can sort of break gender stereotypes to begin with and expand to the advantage of really assisting in mental health mentorship, because I do think that if you are in a situation where you're a troubled teen and you can look and see that there is someone of your gender that is reaching out and that can help you and that can support you, obviously it works both ways. If there's a good female, there's a good male, okay.
Right.
But the point being, if there is someone who looks like you, we had last our last session was with a wonderful pediatrician who was sharing that she happens to be a person of color, and she said that her patients are so gratified that they can see someone, first off, perhaps the same gender as themselves, but it's the same skin tone, the same language, perhaps even the same last name. She has a common last name. And, it makes a sort of a automatic and more immediate trust issue, which is kind of the basis for all further types of communication. So I'm really appreciative.
Yes.
And any last words of wisdom that you would like to share regarding your journey, or how to encourage the next generation of clinical student entrants?
Yeah, I think all of us who work in the field, I think this article was a great jumping off point for people who weren't aware to now be aware. But I think all of us in this field have probably noticed what we've been talking about, the sort of exodus of men, but also, you read about the data, the struggles that young boys and men are having in the U.S. right now. And I think there is a definite awareness that we need to do something different. And I would say, to in terms of encouraging, I would say the very first thing we need to do is think about the things that we make us comfortable and the things that we are really asking. So in schools, we're really asking people who can comply with rules to listen to teachers versus the boy who's talking, right? So we've got to be aware what makes us comfortable and uncomfortable and ask ourselves, what would it take to have a little more discomfort, but a little more representation or spaces where boys can maybe act out, not in a bad way. I don't mean act out like a bad way, but I just mean um, if they have more energy, if they have more talking. These are things, as you pointed out, that we know exist. And then in mental health too, when you're talking about teens who are looking for young teen boys looking for mentorship and guidance, we have to be a little more comfortable there too with this comfort around the fact that maybe they feel awkward talking to, being a teenager is a tough time, right? Especially in your early teens, especially around gender and different genders and just instead of trying to impose this idea that everyone should be fine with any therapist. Instead, thinking about, there are discomforts. How can we minimize clients' discomfort, even if it means expanding our own discomfort? And I think that's the starting point because I think we have created, I always being back to I'll go full circle, being a community-based mental health worker versus a private practice therapist. I'm not working in the world where the thing that matters is how I talk and how my clients talk, which is a lot of what therapy is. And so we need to, I think, get away from the over focus on verbal communication, and we need to focus much more on social and communal interactions. And that would be, I think, the place we really need to also look.
Well,
That's very nice, yes.
I'm hoping that we'll ultimately create a kinder, gentler world, which I know we certainly all can
Yes.
use. Well, I want to thank you. It has been absolutely our pleasure. This is Dr. Esty Hess,
And I'm Dr. Ann Kirsch.
and this is On and Off the Spectrum. We've had a wonderful interaction with
Yes.
Seth Kurzban, and your insights exceptional in terms of why men are not going into the fields of mental health and how we can possibly turn that around. If you enjoyed, in terms of our viewership, if you enjoyed tonight's episode and would like to add your comments or perhaps to be a guest on our show, please don't hesitate to reach out to On and Off the Spectrum, the podcast. And if you like us, please do follow us. Please subscribe. And other than that, I just want everybody to be well and stay safe.
Yes,
Thank you for having
absolutely.
me.
Seth, thank you so much again, and have
Thank
Thank
a
you.
good
you,
night.
Dr.
Please.
Good
Kurzman.
night.
Okay, please
Thank you.
be well. Bye bye.